Hello, lovely people. Welcome back to my channel. This is Abdul Malik, Experience One. If you have not yet subscribed to my channel, please kindly subscribe. Go to the subscription button and then you hit on the notification button for anytime we have any new content, then you'll be able to have access to them. Today, we are going to look at what hypoparathyroidism is. You know that when it comes to the parathyroid gland, they help us, when it comes to the regulation of calcium due to parathyroid hormone. Now, in the situation, we say that the parathyroid gland is on top of what? Of the thyroid gland, and it is the one that helps to regulate calcium and phosphorus what? Metabolism. It means that in the absence of this particular, parathyroid gland or parathyroid hormone, it means that the regulation of calcium and phosphorus within the system will be impaired. And with the issue of what thyroidectomy, you know that if we have the parathyroid gland on top of the parathyroid gland on top of the thyroid gland, and then there is what thyroidectomy or removal of the thyroid gland, and it means that okay, the parathyroid gland is automatically going to be removed, and this is the situation where this particular problem called what high hypoparathyroidism will start occurring because the parathyroid gland, which is in charge of regulating the parathyroid hormone, is what is reduced. It means that regulation of calcium will be impaired. In this case, hypocalcemia is likely to occur. That is why, in this particular condition, with the moment we see it, you realize that the issue of what hypoparathyroidism, or what we call it, hypocalcemia, is going to occur. Why? It is because there is nothing that is regulating the calcium within the system. So, with what production of calcium and the maintenance of calcium within the system is going to be reduced drastically or stop drastically, and this is when we have issue of hypocalcemia. So now let's look at what hypoparathyroidism is. Now, it causes the hyposecretion of parathyroid hormone, and you say that it can also occur after thyroidectomy. So, hypoparathyroidism has to do with what? Hyposecretion or low secretion of or low production of parathyroid hormone. That means that there's going to be issue of calcium regulation. Now, if there is going to be an issue of calcium regulation, now let's see in a situation whereby the calcium regulation is impaired, that means that there's going to be an issue with what? With hypocalcemia. Now let's look at the assessment finding when it comes to hypoparathyroidism. Know that there is going to be what? Hypocalcemia, definitely, and then hyperphosphatemia. Now, phosphate and calcium are in opposite regulation anytime it comes to the system. They are in opposite. Why? Because anytime there is anytime there is hyperphosphatemia or increase in phosphate level within the system, then calcium level goes low. And anytime there's hypercalcemia, the phosphate level goes low. So in this case, if you want to try to correct their activities, it means that anytime there's hyperphosphatemia, you have to try to push what? Calcium to be able to what? To push them out from what? From the blood. That is how their regulation starts occurring. So it means that there is going to be what? Hypocalcemia in what? Hypoparathyroidism. It means the calcium level is going to go low, and there's what? The phosphate level is going to be increased. Now, that is the assessment finding or signs and symptoms of what? Hypoparathyroidism. So these two things are going to occur due to what? The decrease or low production of parathyroid hormone. And then there's going to be numbness. Numbness is going to occur just like how it occurs in hypocalcemia. There's going to be numbness and then tingling sensation in the face. Tingling sensation in the face is also going to occur. And then abdominal cramps and the muscle cramps will start occurring. Just like anytime there is a decrease in what? Calcium within the system, these symptoms manifest. Okay, so when anytime you see hypoparathyroidism, then you can use the signs and symptoms of what? Hypocalcemia to answer them. In as far as you know the electrolyte imbalances with regards to the low calcium level within the system. So we take notice of that. And then there's going to be positive what? Process sound. Now take note in answering NCLEX questions. It is positive, not negative. Positive process sign. When you apply maybe like a BP cuff on the you apply the BP cuff and then you start inflating. You see that in as much as you inflate, the arm will be drawing towards it. It will be contracting. That shows that the person is having low calcium level within the blood. This is very, very dangerous. We call it what? A positive trousseau sign. Now, please take notice of that. The trousseau sign is positive in hypocalcemia. It's positive in hypoparathyroidism. Take note of that. Please, it is not negative because in answer to the questions, usually we say that negative trousseau sign, negative Chauvisted sign, all these are wrong. They are rather positive so that you get your correct marks from there. So take note of that. And then there's also going to be what? Positive Chauvistic sign. Positive Chauvistic sign. Now, this one, when you try to tap the face of what? The individual, the cheek, we see that the muscles there what will be there's going to be spasms on the face. Okay, it will be contracting. That shows that there is decrease in what? In calcium level. It's one of the signs of hypocalcemia and it's very, very dangerous. Okay, so we call it what? Positive Chauvistic sign is going to occur. And then overt tetany. When you talk about overt tetany, such as bronchospasms, now this makes it very critical because anytime you have a bronchospasms, imagine your what? Your bronchial wall, okay, or your bronchus is being contracting, the spasms on it, the person will find it difficult what? To breathe. It's also one of the things that are very, very dangerous. And then laryngospasm, the larynx is also going to be contracted, and this is also very, very dangerous. So laryngospasm is going to occur, and then dyspnea, difficulty in breathing, and then cardiac dysrhythmias can all occur in this particular condition called hypoparathyroidism due to decrease in due to what? Decrease in calcium level within the system. And then you know that airway is very, very important in this particular condition. So take note of that. And then there's going to be what? Seizure attack. Seizures are going to occur, and then anxiety, irritability, and then the blood pressure is going to go low. The blood pressure is going to go low, and then depression is also going to occur. So now take note, in this particular condition, everything move high with the exception of the blood pressure, and then there's going to be also what? Depression. Take note of that. So the positive Chauvistic sign, positive trousseau sign, the abdominal cramp, they are all part of what? High symptoms or hyper symptoms. And then bronchospasms, laryngospasms, seizures, and then numbness, tingling sensation are all part of what? The high symptoms, with the exception of what? The blood pressure going low, which is hypotension, and then depression. Take note of that. Now, how do we intervene with this particular condition? One, you have to also try to monitor the vital sign because in this case, we said there's going to be what? Blood pressure decrease or hypotension. So you have to monitor the blood pressure, okay, or the vital signs. It's very important. And then look at the airway to the SpO2 is also needed due to bronchospasm and the laryngospasms. If you have to check if the patient is adequately ventilating. This is very, very important. And then you monitor for tetany and hypocalcemia. The tetany and the hypocalcemia, because the hypocalcemia symptoms are going to manifest. Okay, like the Chauvistic sign, the positive Chauvistic sign, and then positive trousseau sign. When you see all that, that indicates that there is a decrease in calcium level within the blood. Immediately, you need to try and intervene. And then we said that we have to what? Initiate a seizure precaution. This is very, very important. Now, how do you initiate seizure precaution? You have to anticipate that this patient can go into seizures. So you have to bring all the what? The trace, okay? And then you have to try to monitor, make the environment what? Quiet. And then you stop irritating the patient because anything that irritates the patient can cause what? Seizure attack. And then you have to also try to bring oxygen, a suction tree, all these things around. And in the situation whereby the patient try to aspirate during the course of what? Seizure, you have to suction the patient after the seizure occurs. And then you have to also do not try to what? To restrain the patient while seizure is occurring. In NCLEX, if you do that one, you are wrong because it is not a good practice. Don't hold the patient firmly in the course of what? The seizure. You can break the bone. It is very because due to what? Due to the issue of what? Muscle contraction. This is very, very dangerous in this situation. And we have to place a tracheostomy set, oxygen, and then suctioning equipment at the bedside due to the issue of what? The bronchospasms. And then you remember, if in this particular thing occur, we can do what? A tracheostomy. Can just cut open, okay, the trachea to open the airway for adequate what? Ventilation. So tracheostomy tray is supposed to be brought to the patient bedside oxygen and stuff to be able to, because airway is very, very important due to the issue of laryngospasms and then bronchospasms. This is the way of NCLEX. So in prioritization questions, when you see that one, it means that okay, protecting the patient airway is very, very important. And we have to also prepare to give calcium gluconate. You know, the calcium gluconate will what? Just like calcium supplement to be able to reduce the effect. And the calcium gluconate will also help to reduce what? The phosphate level, and it also help, okay, reduce the Trousseau sign and then the positive what? Chuvester sign, so that the patient tetany will also be reduced and then the condition or the situation will be reversed. So take note, the medication of choice here is what? Calcium gluconate. It has to do with what? Calcium supplement to reduce the effect of hypoparathyroidism or hypocalcemia issue happening. And we have to provide a high calcium diet, and then vitamin D supplement. They are very, very important. You know, vitamin D help absorption of what? Calcium in the system. So if you give more vitamin D, it will help calcium to be absorbed so that the patient can what? Can have a very normal functioning with okay with regards to the calcium, problems. And then you have to also give um binders. Binders will try to what? To promote excretion of phosphate and then through the GI system. They are very, very important. Okay, you have to try to reduce the phosphate level to be able to help the patient. All right, because here we say that in this condition called hypoparathyroidism, there is what? Hypocalcemia and hyperphosphatemia. That means that the phosphate level is going to be increased and then the calcium level is going to what? Decrease. So if you want to eliminate them, you can give a phosphate what? Binders to be able to what? Help the patient excrete the amount of what? Phosphate within the blood through the GI system so that the patient can have what? A better function. And also, we have to instruct in the use of medic alert bracelets. You know, when it comes to medic alert bracelets in NCLEX, it's very important, especially with people who are having chronic conditions and then people who are having a special condition, so that in case maybe they go somewhere and they fall down and maybe they are having issues, someone can come into their aid. And if the person is wearing it, it will help us direct towards what the actual problem the patient is what? Suffering from. And then we can give a quick what? Intervention for this particular patient at a particular, just like a name tag, how somebody will be able to identify you with your name tag. The same way when you wear the medic alert bracelet, it will help someone to know the actual condition, especially in the time of trouble. So we'll take notice of that. Ladies and gentlemen, that brings us to the end of what? The hypoparathyroidism. Okay, next time we are going to look at what hyperparathyroidism is. Have a nice day. Please, if you have not subscribed, try to subscribe. And then if you want to meet us too, please, we are also having a content class that you can come and then we take you through simple method for you to achieve whatever you want in NCLEX. So my creator110@gmail.com is what is the email which will be placed there at the end of the video. Please contact us. Let's help you. Let's help you out. Have a nice day. Thank you very much for having me. Bye bye.